You want to know about cardiac surgery. I'm Dr. Hassan, board certified trauma anesthesiologist, and I'm going to break it down for you. Cardiac surgery is absolutely totally different from the normal type of anesthetic that we do on a day-to-day basis. Cardiac surgery is divided into three major parts: surgery on the vessels that supply blood to your entire heart, the valves inside your heart, or the heart itself. Now, why would you need open heart surgery for your coronaries? This is done when you have a narrowing inside your coronary arteries and you can't have it stented by a cardiologist. Therefore, a cardiac surgeon has to go inside your heart, open your chest, and fix it. Here's an illustration that shows what happens before and after. On the left is a normal heart. Inside the heart, you see there's two vessels that have narrowing because of atherosclerotic plaque, also known as cholesterol. What is happening here is you see these vessels that are coming down. They supply oxygenated blood from your aorta down to your heart, which gives your heart oxygen, allowing it to beat all day, every single day. Over the course of time, you see that there's atherosclerotic plaque buildup, also from cholesterol. This causes a narrowing of the arteries, and when the arteries get so narrow that there's very little blood flow through, and any sort of insult happens where there's a blood clot, that's when you have a heart attack. You can also think of it kind of like a stroke for your heart. Now, typically, oxygenated blood provides all the oxygen that goes down there. When there is a narrowing and when it's not fatal, you can have what they call as a cardiac stent. A cardiologist can go inside your coronaries, deploy a stent, and open up that coronary and or allowing blood to flow normally through your heart. However, if they've tried this already or the narrowing is so severe that they cannot go in and stent it, you need to have open heart surgery in order to restore the blood flow. Now, how do you restore the blood flow? Well, a cardiac surgeon goes inside your chest, takes out a vessel, cleans it off, repurposes it, recycles it, and attaches it to the aorta. From the aorta, they attach it to the coronaries distal, meaning farther along down past the blockage. This allows normal oxygenated blood to go back to the normal route that it used to take. Now, the anesthetic for a coronary artery open heart surgery is entirely different than what it is for a normal anesthesia. During open heart surgery, typically your heart is not as strong as it used to be and it's not pumping as hard as it should. So when we go to sleep, we use medications that are more cardiac stable, meaning they affect your heart a lot less. We also use special IVs that we don't typically use. We put a small IV inside your artery, also known as an arterial catheter. This allows us to watch your blood pressure every single beat. We also put a giant IV in your neck that runs from your neck all the way down to your heart. This allows us to give medication that directly goes from the IV to your heart and it impacts the heart within seconds. Along with that, we also use a special ultrasound probe, a giant probe that we put down your mouth that goes down into your esophagus, sits behind your heart, and lets us see your heart in real time. This allows us in order to see how your heart's doing before and after the intervention is done. It also shows us how well you're hydrated and how well your heart is pumping. Along with that, there's also a portion of the surgery where your heart is not beating at all. During that portion, we put your heart and your body on what is known as cardiac bypass. This is a life-saving machine that comes out of your chest, goes to a machine which then oxygenates your blood and sends it back to your body and circulates the blood all throughout your body. This allows for a cardiac surgeon to work very quickly to fix your heart as fast as possible. Now, cardiac surgery is very interesting but also very risky. If you like this content, please like and share for more.